Thank you so much, Mr. Chairman. In discussing this matter, I wish to first appreciate all of you partners in population and development for getting together to share different experiences and to support one another in this endeavor. I think this is the way to go. We do talk about population and development, partners in population and development. And increasingly, the emphasis has been on matters largely on population issues, the soft part of it. And increasingly, we have not paid so much attention on the issue of development. And there is a very strong correlation between the population and development, particularly the development of infrastructure, economic and social infrastructure. It is economic development that supports the well-being of society. It's that economic development that supports the growth in the population indicators, the improvements in population indicators. And therefore, in moving forward, my view is that we need to enhance and strengthen cooperation in areas, especially of knowledge sharing, in the area of development. I'm talking about development in the sense that we are able to expand our economies, because as we eradicate poverty, as we build stronger economies, as we build resilience in our economies, what we are doing practically is to provide more individual support in terms of dealing with the population-related issues on reproductive health and so many other related issues. So in discussing this topic, I want to make a contribution in terms of the evidence that we are providing as Uganda on the progress that we have made in achieving the ICPD and SDGs, particularly in improving reproductive health, maternal and child health care services, improving reproductive health commodities and modern methods for family planning services. And the following are some of the achievements. The maternal mortality rate has declined by 44% from 336 deaths per 100,000 in 2016 to 189 deaths per 100,000 in 2022. And that's a drastic reduction. And this reduction has surpassed the financial year 2022-23 NDP3 target of 261 deaths per 100,000 live births. And this is in line with achieving the SDG target of 140 births by 2030. In addition, neonatal mortality rate decreased by 22% from 27 to 22 deaths per 1,000 live births in 2022, which is close to the financial year 2022-23 NDP3, National Development Plan target of 21 deaths per 1,000 live births. Between 2016 and 2022, the proportion of births attended by skilled health personnel increased from 74% to 91%. And the infant mortality rate has reduced from 43 per 1,000 live births to 36 per 1,000 live births in 2022. Under 5 mortality reduced also from 64 to 52 per 1,000 live births. In terms of modern contraceptive prevalence rates, this has increased from 39% in 2016 to 43% in 2022. and the unmet need for family planning, however, reduced from 26% in 2016 to 22% in 2022. The 2022-23 Annual Health Sector Performance Report indicates that while the overall availability of health commodities dropped to 59% in 2022-23 from 78% in 2021-2022, the availability of reproductive, maternal, newborn, and child health commodities was only at 57%. However, delay in mothers seeking help, lack of transport to get health facility, and then to referral when needed, as well as lack of blood products, commodities, supplies, and absence of critical staff continue to affect the quality of intrapartum care. Now, regarding how South-to-South triangular cooperation has accelerated the progress of ICPD and SDGs, through the South-to-South cooperation, the People's Republic of China in 2001 donated sophisticated reproductive health equipment worth $300,000 and 2 million condoms to Uganda to boost the country's efforts to promote reproductive health. And this equipment was handed over to Uganda's health minister then. The equipment diagnostic included X-ray machines, ultrasound machines, mammograms, laboratory machines. China also gave several donations to Uganda, including a 100-bed general hospital constructed in Uganda, and we want to appreciate them for that support. Over the last 30 years, Uganda has profoundly benefited from the long and short-term trainings by member countries within the South-to-South Triangular Cooperation Arrangement, and which have enhanced the capacity of Ugandans to develop and manage sound population and development programs. And such human resources development has also been accompanied by technical capacity exchanges and technological transfer, mutual exchange, and sharing of experiences at high-profile inter-ministerial conferences like this one, and at implementation levels through field exchange visits that provide real synopsis of the South-to-South cooperation. We can also forget about the existence of PPD-UNFPA, which is the Partners in Population Development in the African realm, the African continent, and that office, regional office, is stationed in Uganda. But it has done quite a lot in terms of the delivery of the PPD objectives. What is required is to support this agency further, to continue supporting the entire region in terms of the delivery of services. So we indeed would wish to welcome any support in that endeavor. Over 50 Ugandans have acquired diploma masters in demography at Cairo Demography Center, Egypt, the diploma in public health management in India. All this is support. The population policy analysis at the Southern University in Mafeking, South Africa, and several others benefited from the short seminars and capacity building workshops on maternal and child health, population, environment, and development in Bangladesh, China, South Africa, and Tunisia. And all these seminars have been supported by host member countries within the South-to-South Triangular Cooperation.
Thank you.
The PPD-UNFPA, which I just spoke about, through the support to the Eastern Africa Reproductive Health Network, has collaborations of partner institutions, Makerere University in Uganda, the Institute of Statistics and Applied Economics. All these joined other institutions from the PPP member countries to better network and commit to building mechanisms for sharing and disseminating lessons and best practices. PPD supported the World Bank project, raising voices from the South for integration of human rights-based approach to maternal health. Also, the South-to-South cooperation has helped to strengthen regional markets, increased trade, and attracted investment, contributing to economic growth and poverty reduction. And this is where I started from. More support is needed in these areas, especially for countries that are still underdeveloped, to help them build those economies to be able to support healthcare services in those countries. Through the Africa Climate and Health Action Network, African countries also collaborate on climate resilience, adaptation, and mitigation efforts, sharing innovative solutions and technologies to advance climate justice and address climate crisis. Uganda has also collaborated with China on infrastructure development projects, in example, renewable energy, transportation, and water management, driving sustainable development and economic growth. So those are some of the highlights of the benefits we have had, what we have enjoyed from the South-to-South collaboration. In terms of challenges countries are facing in implementing SSTC at the national level, we note that SSTC is a trilateral cooperation between two member states and development agencies. There are usually several coordination, financing, and monitoring challenges. And we have noted the inadequacies in terms of policy, legal, and regulatory frameworks becoming barriers to the South-to-South triangular cooperation. For example, Uganda does not have a national policy on SSTC. The inadequate institutional setup, resource mobilization, allocation, and expenditure hamper SSTC initiatives. Uganda has not set up mechanisms to comprehensively focus on SSTC, and I believe many other countries are like that, and allow to tap SSTC opportunities. So we need to have strong institutions in this initiative. Poor communication, knowledge management, and lack of awareness about SSTC at all levels. We are not doing well yet in terms of communication and knowledge management. In fact, we don't have a repository of knowledge on these issues. And also the low levels of local ownership and the lack of local employment opportunities arising from the existing SSTC initiatives. The issues relating to institutionalizing SSTC were ably discussed by the keynote speaker. Now, in terms of the action that can be taken by the southern countries for promoting SSTC in addressing unfinished ICPD and Agenda 2030, on top of what the keynote speaker proposed, we think that there should be more multilateralism required and covering the academia, civil society, the private sector, government, and others, noting that the concept of partnerships is enshrined in Sustainable Development Goal 17. So we need to unbundle it and roll it out to various member countries. Number two, the creation of an enabling environment with regulatory frameworks to promote SSTC. And number three, the establishment of partnerships and coalitions between countries to share experience and knowledge, as well as the development of and sub-regional strategies. With those few remarks, thank you so much for your attention.